Over 50 children in Grenada benefited from an ophthalmology diagnostic clinic led by the World Pediatric Organization CARE, with support from the Pediatric and Ophthalmology Department at the General Hospital. The two-day clinic, held at the eye ward of the General Hospital, catered to children up to 17 years old who suffer from various eye diseases or various impairments affecting their daily lives. The children who benefited were either referred by local doctors or identified through a school screening initiative that targeted grade 1 students experiencing vision problems. Lead Dr. Donna Brown, a pediatric ophthalmologist with the World Pediatric Organization, spoke about the initiative.
The World Pediatrics Organization has sent visiting diagnostic and surgical teams to the Eastern Caribbean for 25 years. We started out this trip in St. Vincent and the Grenadines. Well, a couple of years ago, I met Dr. Julian, who's here in Grenada, and she and I collaborated on several cases from a long-distance standpoint, and it had long been important to us to do a diagnostic trip and clinic here in Grenada. So we finally got that opportunity this week, in part due to a grant that has allowed countrywide screening of, I'm told, over 200 children.
Dr. Brown highlighted some of the most common eye conditions diagnosed during the two-day clinic.
We do have subspecialists in the region. We've had some of the children here in Grenada who have gone to Barbados for glaucoma surgery, and that's been some of the more serious cases that we've seen this week. And the variety of things that we see that are pathologic and need help include pediatric glaucoma, including congenital glaucoma, meaning children are born with that condition. We've seen a lot of children with strabismus. We've seen children with congenital cataracts. So lots of need, lots of great work here to be done on the island by the ophthalmologist here, and World Pediatrics simply wants to help where we can.
She further explained that 25% of the children examined required surgery, with some needed to travel within the region for specialized treatment, while others may undergo surgery in Grenada around June or July.
We have what we call a reciprocal agreement with surgeons in Barbados. So once they get to Barbados, the care is not charged to the family. There are times when Inter-Caribbean Air will help us with the airfare if the family doesn't have means. A lot of times the families will come up with the means at least to be able to get to the care. But all of the care by the doctors, the nurses, the anesthesia providers, the supplies, all those things we consider gift in kind.
Dr. Natalie Julian, a local ophthalmologist and eye surgeon at the General Hospital, said clinics like these play a crucial role in improving the lives of children with vision challenges.
Urging persons out there who know children in the community that may not be part of our clinic and screening program, but if you identify children with crossed eyes, you think they have visual deficits, they're looking at things very up close, they're struggling in school to see, especially with the teachers with the school program, any children you identify with those visual impairment, we're asking you to refer them to the eye clinic so that we can make the necessary evaluations and referrals necessary. Once you have a child identified that is in need, you see your district doctor, you get that referral note, and you bring the children into the clinic and we set an appointment to see them.
Rena P. Thomas,